Hello there, Holistretch fam. Welcome to this Holistretch video. My name is Frances Eve. In this video, I will show you how to help your clients and your friends and family with a tight, stiff, low back. This could be someone who is lacking mobility in their spine, or they just have really tight hips and need to loosen up. Please subscribe to the channel if you haven't yet done so. That really helps me out and I really appreciate it. Thank you. All right, let's begin. So we're going to go ahead and start with just loosening up the hips by grabbing onto the heels of the feet. And we want to loosely grab onto the heels. So just let the heels sink into the palms of your hands. And then you can take the feet, bring them to your hips, and rock forward and backward. What this does is this loosens up the whole spine and releases the neck as well. Next, we're going to open up the psoas. So we take the left leg over the right and we come over to their left side. Next, we bring our outer hand, our right hand, to their psoas area and gently press down as we pull the legs towards our body. This is a nice diagonal tilt. This helps release the psoas. And this helps stretch the lower spine, namely the muscle of the quadratus lumborum. Next, we'll go ahead and switch sides. So switching legs right over left, we'll go ahead and bring our hand to their psoas once again, pulling their legs towards our body. Having them take some nice deep breaths. Take some nice deep breaths yourself. Nice and gentle. Beginning to open up their whole side body. So this also opens up the ribs, the lungs, allows them to breathe a little deeper. Very nice. We'll gently bring the feet back. And we're going to take the left leg here and bring the right arm underneath. So as you do that, go ahead and gently pull the leg towards your body and see if you can sort of loosen up their hip by just rolling the leg around, having a nice cradle for the heel of the foot, and then a nice cradle for underneath the knee, and then allow yourself to move your body in such a way that their hip begins to loosen and open up. So just nice big circles here. And when we do these directions, you will see where they're stiff. You'll see where they're tight. So for her, she was tighter on the lateral hip. So I'm adducting the leg just a little bit as we come forward, bringing the heel to the shoulder, leaning the body forward. Remember that when we are assisted stretching, we're not using our muscles as much as we're using our body weight. This allows us to stretch for a long time and go even deeper into the stretches. So you want to go ahead and have your client press into you just to activate the muscle, and then we can create more movement and more flexibility in that leg. Let's come back to opening up the hip into those circles and notice where else they're tight. So for her, it seemed like her inner thigh was tight. So what I'm going to do is open up the groin. And how we do this is bringing the foot to the hip and then driving your hip forward. Make sure that it's not too much forward such that they have enough strength to push back into you, and then slowly release. When they slowly release, make sure there is still some tension and some resistance because you don't want to overstretch them. We're going to do a few in here as she started to slowly open up into the inner thigh and the groin. So for this person specifically on my table, who is my mom actually, she has a very, very sensitive and tender body. So I take things very easy, very gentle, very slow. It depends on the body of your client. You may have someone who is a bit denser, heavier, stronger, and you might want to go a bit deeper, a bit faster. But for her, I'm going very, very gentle. Next, we're going to go ahead and open up the lateral side of the hip. So we're going to start getting into the TFL. And how we do this is sliding that left leg underneath the right, and then bringing the left leg to your hip, walking this time to the right side of the body. As we do this, they have a nice tension against your hip. You can gently drive your hip forward, and you can even have them push back into you just a little bit with that foot. What that does is that keeps that leg activated. So I want you to feel that your client on the table is activated, that they're resisting the stretches, and they're opening up deeply. Very nice. We'll take a deep breath and then come back. We'll move on to the other side. This time cradling the heel and underneath the knee like we did before, and seeing if we can make those circles again. Remember, every time you make those circles, just keep in mind what area of their body you feel the most tension and tightness. Sometimes you'll even notice shaking or quivering. That's a weak spot that you want to really focus on the flexibility on the other side and the strength in that muscle. Most of the time, I like to do the same stretches on the other side, but once in a while, the two sides will be very, very different. And in that case, it requires a different stretch. So just use your intuition on this one. Again, in general, just do the same stretches, but sometimes you'll notice that there's a vast difference, in which case you will want to do different stretches for each side. So the right side, we're going to go ahead and open up the hamstring once again, bringing the foot to the chest and leaning the body weight forward. Taking some nice deep breaths. And you can have them push in and release. And we'll bring it around so that we can open up the groin, foot to hip, and we'll drive the hip forward. You can have your client once again just gently push into you. It doesn't have to be a big resistance. It could just be very, very small. Again, like I said, her body is very tender and sensitive. So for her, she really didn't need to push in that much to feel a big sensation. And then when you feel like they're finally getting flexible, then you can have them extend even deeper. I generally like to do between 4 to 6 resistance stretches, but sometimes you only need a few to really make a difference. So use your intuition on how many resistance stretches to do in one spot. Take some breaths. Remember, whatever we do to the inside, we want to do to the outside. So we just stretch the groin on the inside. Now we're going to stretch the TFL, which is the outside. And we'll do that by bringing the left leg over the right and then standing to the left. Bringing that leg to your hip and driving the hip to the side. Now again, you can have your client gently push into you And then you can create resistance by driving the hip even more, even deeper, opening that QL, opening the psoas, stretching out that mid back. We'll go ahead and come back to that bent leg and see if you can make some circles once again. See if you've created any more flexibility in here. I always like to come back to the loose hip if it's someone who's extremely tight in their low back. This really helps you to see the work that you've done and the results you're getting. Now we're going to work into the glutes. So we're going to bend the leg at like a figure 4, and you can bring their foot towards your knee and drive the knee forward. Sometimes just this gentle figure 4 stretch is all someone really needs, especially if they have a lot of tension. But if you feel like this is too easy for them, then you're definitely going to want to practice those resistance stretches by having them push their knee out towards you. For the gentle version, we're going to go ahead and have them actually do a figure 4 by grabbing onto their bottom leg and maneuvering this stretch for them. So this feels super, super good, especially for people who aren't very flexible and can't get into this posture. You can help them get into this posture and then drive your body forward to give them that deep hip stretch. And gently bringing it back down. And we'll go ahead and end this side by giving her a nice spinal twist. So coming to the right side of the body, you want to draw that left leg all the way over to the right. By pulling their leg over your body, you can bring your other arm to their sacrum to support them in their spinal twist. Sometimes I'll do some tapotement on their sacrum, or just a gentle loving hand right here helps them to release and relax. And we'll go ahead and move on to the right side. So picking up the right side, we're going to go ahead and work on that hip. We've already worked the groin, and this time we're going to work the glutes. So bringing the foot into a figure 4, you can rest it on your knee, use that as support, and then drive the body forward. Always be sure not to overstretch anybody. So always check in with your client or your partner. Always make sure that everything feels good. If they're complaining that they feel really tight, well, maybe they just need the stretch. So ask them to resist, and in that way they are contracting their muscle and shortening while they're pushing out. So that way they get the natural flexibility and you're not overstretching them. And I'll bring it back down. Coming into the assisted figure 4, so go ahead and taking their other leg, bringing the foot to your chest and driving your body weight forward until you feel that they're getting a great stretch. If you are new to assisted stretching, never be afraid to ask the person on the table how they feel. If it's feeling good, if they're feeling tight, if you need to back off, or if they want you to push further. Communication is key. Sometimes it's subtle, but never assume. And coming back out, we will end this side by bringing them into a spinal twist. So bringing the right leg across the left side of the body. Remember, you can turn your back towards them to pull their leg in front of you. Bring the other hand to their sacrum to support in the twist. It's been my pleasure to serve you in this video to show you how to open someone's low back. Please comment below if you're interested in keeping in touch. I am creating an online course and would love to hear any kind of feedback about what you'd like to see, what you'd like to learn. I'd love to support you in any way that I know how. Thank you again so much for watching the video. Please subscribe and I'll see you in the next one. Feel free. Take care.